Diabetic retinopathy is a complication of diabetes that is well established. Why this complication is developing in the eye? That is the question now. So we can see that some etiological factors which is capable of developing diabetes is capable of developing some pathological changes in the eye also. In Ayurveda, there is a term like chakshusya. That means the factors which is capable of acting in the eye or ophthalmic tissues. All drugs or all food items or all habits will not touch the ophthalmic tissues. So, that factors which are capable of developing negative changes in the eye is capable of developing diabetes also. That is why in some people these ophthalmic complications are developing easily. That is, that person will be having some etiological factors which are common for eye disease and for diabetes. For such people, there will be ophthalmic complications of diabetes. That is the actual thing. So, in such a situations, we have to give equal importance for the treatment of diabetes and the treatment of this eye disease, because it will attain an independent entity. So, we have to consider it as a separate disease and do the treatment. The diabetes touch actually the microvascular system of the body. In the same way, the microvascular system of the retina also. So, it will make some changes in the retina. And since this person was doing the etiological things or some habits or food items, whatever it may be, which is capable of acting negatively in the eye, and that person is also a diabetic person, then the situation becomes serious. They're just controlling the diabetes or just controlling the one single symptom will not give any result. In diabetic retinopathy, there will be the possibility of leakages from this vascular system, it is the blood vessels. So, that one method for the treatment is to stop the bleeding, to arrest the bleeding by any method, maybe laser or whatever technology or medicine, whatever it may be. But the pathology which was a basic reason for this hemorrhage is still remaining. If it is not touched by methods, remedial measures, surgical or this medicinal or whatever it may be, if it is not controlled, then the possibility of bleeding is still there. What will happen if you are sealing one point, it will bleed or leak from another point. So, in such a situation, the first aim of the treatment should be to maintain or to re-establish this circulation or the vascular structure and situation in the eye. For that, medications are absolutely necessary. In Ayurveda, there are methods to maintain the circulation. We will say Rakta Shuddhigaram or like that, so many treatments and medicines and mode of applications are there. By that methods, in a diabetic retinopathy patient, we will be trying to control this vascular system or the circulation first, so that the tendency for accumulation of fluids and leakages can be controlled to a great extent. Then only we can say that is a remedial measure. So, first of all, we have to control the vascular system and then see what is the next step. If there was severe bleedings and there were clots, Bleeding means it will not be bleeding continuously 24 hours. There will be some bleeding, then it will change to clots. And these clots will be in the retinal layer, or if in the severe cases it will go to the vitreous fluids. And then there will be deposits or these clots in the vitreous gel and also in the retina. So in such a situation, sometimes it will not be possible to remove the clots by medicine or by simple methods. Then this type of surgery will be advised recently to remove the fluid as such and fill with the silicone fluid or some other gas. There are so many methods which is not known to me clearly. By allopathy methods, the people say that surgery is advised, and this is what doctor has explained to me like that. Anyway, they are removing the vitreous fluid and filling with some other materials, fluid or gas, whatever it may be. So, to avoid this surgery, what is the solution? We have to handle this condition in different stages. It is not an easy task. First of all, we have to control the circulation, then come to the next level, whether there is clot or fresh hemorrhage. If there is fresh hemorrhage, no doubt the first step of the treatment should be to arrest the bleeding and then control the circulation. Then come to the next stage to remove the clots. For that also there are methods in Ayurveda, but we have to get an assurance that the fresh hemorrhage is totally arrested. Then we will move to next treatment to remove the clots or other deposits. For that we will say Shodhana Chikitsa in Ayurveda, by which the unwanted or unnecessary materials are removed from the body, here from the these ophthalmic structures. That is possible. So in short, we can avoid this surgery if we are handling the case carefully, step by step with confidence, especially in 3 steps. One is the circulation maintenance, second is the arresting the further bleeding, third is the removal of clots and deposits. Beyond everything, the blood sugar should be under control. That is the basic reason. If you are managing this case in such a basic methods, or according to the theory and according to the basic principles, we can control the condition and avoid the surgery.